Hi, my name is Clarice Taylor. I'm a nurse practitioner student at Maryville University, and today I will be doing my neurologic exam. This is a 26-year-old African American female who has agreed to participate in the exam. I would be beginning my exam in five areas, which include the mental status, the sensory and motor, which includes coordination, and the cranial nerves. I will first begin out with just a mental status in general. She's is alert and oriented to person, place, and time. Um, and then I would do my cranial nerves. Cranial nerve one is the olfactory, which is the smell. In most cases, it's not used in a clinical setting unless the patient comes in with a complaint of a with a problem with smelling, and then of course then would assess it. And usually you would just take something like a mint, coffee or something, let her close off one nostril, and then let her smell and tell you what it is. The second cranial nerve is your optic nerve. I will be testing her visual acuity and then test the visual fields by confrontation, and then I would examine the fundus of her eye. Um, she was a 20/20 on her vision personnel chart. Then now I would examine her eye um, with the ophthalmoscope. And then I would just take a look in there, looking for the optic nerve and looking for any abnormalities in the eye. I would take my right eye to her right eye and take a look in her eye. Look up there. And I will look in the fundus and optic nerve is noted and no abnormalities noted. I would look for accommodation, um, and so I would ask just look at my nose, and then when you see my finger wiggles, let me know.
Yes. Yes.
Just keep your eye here.
Yes. Yes.
Okay. So everything looks intact and normal. And then I would test cranial nerve 3, which consists of oculomotor. Uh, it'll test cranial nerve 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. And all of those involve the movement of the eye. And so I would test the ocular movement by the 6 cardinal position of gaze. Okay? Look at my nose. Okay? Follow my finger with your eyes. Do not move your head. Okay? Then I want to go in. Let me know if you see double vision. Any double vision? Weird. Okay. That's intact. Then I will test cranial nerve 5, which is a trigeminal nerve, and it tests the motor function. What I will be doing is testing the motor function by palpating the temporal and masseter muscles as the patient clenches her teeth. Clench your teeth. You have them clench? Okay. So that's intact. And then I will test the sensory function by light touch of with the light here. And let me know if you feel this. Close your eyes. So that is intact. Okay, then I will test cranial nerve 7, which is the facial nerve. I will test the motor function. I will ask the patient to smile. Then frown. Okay, close your eyes tightly. Okay, and let's see, can I open it? Close them tightly. I should be able to open them once you close them tightly. Lift your eyebrow. Okay, show your teeth. And then puff your cheeks. Okay, good. That's all intact. Next, I will test cranial nerve 8. That is acoustic. So I'll be using the whisper test, and then I'll be using the Weber and the Rini test to test for a hearing. Just cover one of your ear with your. So I'm gonna say a word real softly, and then repeat what I say. Okay?
Apple.
Peach.
Peach.
Okay. So she's able to hear the whisper. So now I will use my tuning fork and test for the Weber and the Rini. Okay. When I strike this, I'm gonna put it on top of your head. Let me know when you can't hear the noise anymore. Okay. I'm gonna pull your hair back and get back into your mask door. Okay. All right. Put this back here. Let me know when you can no longer hear it.
It's gone.
Okay. It's intact. Okay. Then I will check for cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagus nerve. I would test the function by depressing her tongue and checking her gag reflex, and then the tongue movement. I'm gonna get my tongue blade. Stick your tongue out for me.